want to be practical. So if you look at this pH, like I said, pH 7.4, CO2, what, 35 to 45, but a lot of times it's 40. Like if you choose a number, it's 40, it's a normal. And then the PO2, technically less than 60 is hypoxemic, you know? So 60 to 100 is, you know, kind of normal. And the bicarb is 24, 22 to 26, but 24 typically is your cutoff. So you need to figure out, is this respiratory or metabolic? Let's say this example. pH of 7.2, PCO2 of 31, PO2 of 92, and a bicarb of 15. So you kind of look at the pH and the bicarb, I want to say which direction. So this is low, and this is low. So if they're kind of pointing towards the same direction, it's metabolic, and you know, Peter might correct me if I'm wrong, but whatever. So, you know, so maybe, looks like it's a metabolic, you know, they're both low. So metabolic, so, you know, you can blame renal, you know, not pulmonary. Just kidding. So it's metabolic, you know? So, because you need to figure out in your mind, is this a metabolic or is this a respiratory issue? So that you have that. Now the question, is it a metabolic acidosis or is it a metabolic alkalosis? So since it's low, right? Bicarb is 24. Since it's low, it's probably metabolic acidosis. Okay? So metabolic acidosis, the bicarb drops, so you have more acid. Okay. CO2, carbon dioxide, you know, it's kind of like an acid, you know? So to compensate, what will the body do?
If you have a high CO2?
If you have a, exactly, you blow it off. If you have acid in your body, you know, you try to blow it off, right? That's why you see people, like with DKA, you see the Kussmaul's like, because they're blowing off carbon dioxide, extra acid, excess acid, you know? So to compensate, the body's smart, to compensate, you blow off. So you should see a trend in your CO2 to go down. Okay, if it's purely metabolic, that sort of thing. Okay, so looking at this, you'll say, that's probably metabolic acidosis. That's it, you know. But it could be complicated, you know. It could be mixed, combined, whatever. But primarily, you know, for our, you know, quick and easy, you know, oh yeah, that's metabolic. Okay, but then if you, let's say, if you end up, let's say the CO2 is like 60.
That's a respiratory acidosis.
Exactly, right? You'll probably say, you know what? Yeah, it's probably respiratory acidosis with some metabolic. Exactly, that sort of thing. And there's a whole slew of formulas, and I'm not even sure, you know, if it's even helpful and at all, you know, that sort of thing. So that's that, because you need to figure out. Okay, that sort of thing. So metabolic or respiratory. Now, there's compensation, right? You know, if it's metabolic acidosis, like I said, you compensate by blowing off. You know, there's the Winter's formula. You've heard of that? Winter's formula. It's 1.5 times the bicarb. There's different ways, you know, because you could be overcompensating. So 1.5 times the bicarb. So this guy's bicarb is 15. So 1.5 times 15, 22, plus 8, you add 8. So that's 30.5 to see what the compensation for the CO2 is. Okay.
Winter's formula?
Winter's formula. It's 1.5 times the bicarb plus 8 plus minus 2. So if the bicarb is 15 and you know you're blowing off, then your CO2 should be like, to compensate, to say purely it's metabolic acidosis compensated, the CO2 should be 30, you know? Which it was 31. That's fine. So that's purely. But then, you know, if in that ABG the CO2 was like 40, then in your mind, you know, the patient is retaining, you know, probably tiring out. So there's probably some you know, respiratory acidosis, that sort of thing. Okay. I know it's a little technical, but you know, that sort of thing. And I don't want to be technical, but you know, just so you know, at least recognize that, you know. Perfect. So that's one extreme, because a lot of times, you know, with the severe metabolic acidosis, you see the pH drop and the bicarb drops, so that sort of thing.
Yeah.
So I'll be quick. In this one, I was trying to remember the formula, but this is very important from our end, because you would always hear like acute and chronic hypoxemic respiratory failure. Like, what is that, right? So, okay, I'm trying to simplify. So if you see this ABG, pH, PCO2 is 60 and PO2 is 60. So what's that?
Getting-
Like what's wrong with
It's a
that?
normal pH but elevated
The
CO2.
PO2.
I know, right? So what
He
makes
told me when
exactly
it
right?
CO2
So that
is
looks like it's
elevated.
chronic.
Okay.
Like your typical,
Okay.
that's our bread and butter, you know, the typical
Oh.
COPD. So you probably hear like, yeah, they probably live in the 60s, that sort of thing, you know.
Right.
So if that's normal, and then that CO2 is normal, that's 60, you know. So like with that, I'm not scared. Like, okay, that's fine. They're talking, yeah, that's fine, you know, that
Okay.
sort of thing.
Yeah.
As long as the pH, you know. But obviously, make sure that they're fine, that sort of thing. So that's important, you know, because a lot of times, you know, the chronic COPD, let's say they come in with a pH of 7.35, and then let's say this PCO2 is like 70. You know,
Yeah.
if you think about it, it's kind of near normal, right?
Right.
3.5. So, you know,
But the
if
CO2
you
is
just
elevated.
exactly right. So if you look at it at face value, like, oh, you know, I guess I should take it back. I guess what I'm trying to say is the CO2 doesn't look as bad if you look at the pH, basically, because it's compensated. That's probably where he lives at, you know, and then it's probably mildly flared. That's why, you know, 7.35 and 70, you know. But so that's what we call acute and chronic hypercapnic respiratory failure. I know, right? So semantics, right? So I guess a lot of people are ARDS, but strictly speaking, you know,
Right.
there's acute hypoxemic respiratory failure, and there's acute hypercapnic respiratory failure, and there's acute hypoxemic
Mixed.
hypercapnic respiratory failure,
No.
and there's acute on chronic hypoxemic hypercapnic respiratory failure. It matters because the billing matters, right? The more stuff there, the more we get paid, which happier people. but then again, you know, you have to be truthful. That, you know, acute and chronic, you know, hypoxemic hypercapnic respiratory failure. So, and you will, I guess you have to be careful because I don't think you get the queries right from the billers.
yeah.
now.
Oh, we do.
We
yeah.
do.
Because when it
Painful.
comes to that, yeah, because
that's brutal.
I guess,
Yeah.
and I even have to check again now, you know, with what technically is hypoxemic or hypercapnic, because they change, you know, the guidelines change and all that stuff.
So will
So-
you go back and look at their prior ABGs from prior admissions to kind of
Exactly.
see where they
Yes,
live? Okay.
exactly. But then if you look at this ABG, and there's a formula, I'm just forgetting it, you know, if it's acute and chronic and you do the math, you know, if let's say, I don't want to give you false information, let's say normal pH is 7.4, and then if they're chronically hypercapnic, you know, if they live, let's say, normal PCO2 is 40. If they live in the 50s, you know, the pH chronically should go down, you know, by a certain number. And I was trying to look for that, I couldn't, but I'll let you know tomorrow, like what the compensation is to actually compete for it. But you know, with me at least, I just eyeball it, you know, like I don't think you'll compete it. But I guess you get the sense, right? Because you get the sense here that it's chronic, right? Like he lives in the 70s or he lives in the 60s,
Yeah.
so that sort of thing. So that will be my assignment. I need to give you the actual number so you know exactly what the compensation is. So, so hypoxemic is less than 60. Okay, I want to say the PO2 is less than 60, hypoxemic. And I want to say there's even a difference between hypoxic and hypoxemic. I know, right? So hypoxic, I think, acute hypoxic, if you say, and don't quote me on this, I want to say if it's the SATs, that's hypoxic. Hypoxemic is the blood.
That makes
You know?
sense.
Because obviously sometimes you cannot get a blood gas, so it's probably, you know, hypoxic failure. And then these people, so that's the acute, or that's the hypoxic. Hypercapnic is typically, I don't know, more than 45. You know, if the CO2 is more than 45, then I would say, yeah, that's hypercapnic, that sort of thing. And hypoxemic, you know, if it's, you know, requiring oxygen, that sort of thing. Now, I add the acute and chronic. Let's say this guy, like this gas, because that's normal for him, but that's not normal in someone without any lung problem, right? So if this guy ended up being admitted and that's his ABG, like a COPD flare-up on BiPAP. So it's an acute on chronic, hypercapnic respiratory failure, that sort of thing. Okay. So that's that. That's being brief with ABG. Check
Okay.
pH, PCO2, PO2, and the bicarb. And he'll probably be more technical. Good.
Okay. Thanks a lot.